because you work with the model, you work with the doshas and the koshas.
Yes.
I'm just, do we learn how to test for someone's dosha, or do we just go by what they tell us and maybe what the traits they're exhibiting are?
Yeah,
Or do
so
we learn?
yeah, it's a good question. So we're not looking at their innate, so there's two types of doshas, right? There's your what you're born with, and then there's how like the sort of outside world affects you. And so we're mainly looking at symptoms. So as yoga therapists, we're looking at which dosha is imbalanced currently. So
Okay,
we're not looking at who they are. That's not actually important. And the reason for that,
not really looking at
um,
their dosha. It's just something like if they come
right.
to us and they're exhibiting certain behaviors or traits of one than the other, then we can deal with it from that perspective.
That's how we look at it. And then there's a little bit more to that, but that's basically it. So that, um, because what you with your innate dosha, right? That that gives you a clue. What's interesting about that is that gives you a clue of the way you will probably go imbalance. So in other words, right, if you're a Vata person, you're more likely to go Vata imbalance. Does that make sense?
Mhm.
But that doesn't mean that a Kapha person can't have a Vata imbalance. And so that's what we're concerned with. We're less concerned with their um, and part of the reason for that is we do less with food and things like that. So when you're looking at food, you'd want to know probably more about their sort of genetic constitution, so you could say prescribe the correct diet for them. But in yoga therapy, you're more teaching them how to balance themselves, no matter, you know, based on what's happening for them.
Then what is the difference between yoga therapy and Ayurveda?
So Ayurveda is a medical science, right? So it's more akin in some ways to Western medicine than what we're doing, right? And generally, even though Ayurvedic doctors recommend lifestyle things and sort of are more integrative, much of their treatment has to do with herbs, right? So medicine. So it's also a life science, and because it's old and sort of spreads, you can look at it that way, because it's a tradition of healers versus sort of medical schools. But all that said, um, yoga therapy is a like self-education system where somebody gets skills and techniques to learn more about themselves and then therefore how to balance themselves, right, through experimentation. Um, and Ayurveda is a medical science where you go to a doctor and you say, I have this thing, and they say, take this pill, and do 20 sun salutes a day and try not to eat raw food. Do you see what I mean?
Okay.
So it's like more prescriptive in that way. So in yoga therapy, we're not as prescriptive. I mean, that's one big difference where we say, here's what I think's happening. Let's do some practices, and then you're going to give me feedback on what those practices do to you. So I'm not saying they are sister sciences, but if you're trying to separate them in your mind, that's where I would start. Even though there's a lot of and I'm sure an Ayurveda person who just heard me say that would completely freak out right now. But because that doesn't really describe Ayurveda very well. But we're doing yoga practices, right, for like self-education versus prescriptions. Very different. So if you go to an Ayurvedic doctor, right, they're just going to tell you what to do. You could do that with a yoga therapist, but that's not exactly how it works. We're in a relationship with them that's different.
And we use different, well, I guess Ayurvedic practices too, but we use different models, like, the
I
kosher
would say we use
therapy.
different models and we especially use different techniques. So even though Ayurveda people often recommend yoga, my experience has been they have no idea what they're doing in terms of yoga therapy, right? Because they don't think about that all day. So they'll say sort of general things, but they spend all their time and energy like making sure they're giving you the right herbal combination, which we don't know anything about. So they're complementary, but they're pretty different. Yeah.
In the therapeutic sense, they are. Yeah.
Yeah. I mean, experientially for the client, they're way different, I think. You know, I mean, what's similar is that they both come out of this belief system science that says that balancing yourself, right, is the road to health, right? And that there's different ways to do that. And then it gets really messy when you think about like Ayurvedic yoga, because you're actually combining two things. So that's what we do sometimes. It's yoga based on Ayurvedic principles, but it's not exactly Ayurveda. Because the first thing, if you go to an Ayurvedic doctor, like they might, like the first thing they'll do is look at your tongue, take your pulse, right? Do a question. I mean, it's just a different protocol. They're like, I'm figuring out which dosha's imbalanced right now, right? And then I'm going to take that in with all this other information and give you like, hopefully the perfect prescription to set you back to balance.
And we're, and yoga therapists are looking at, okay, this is what you're exhibiting, and we're going to try doing this today.
Right, we're going to be in relationship with you in a way. So here's some techniques. You might say, you know, as you go through the course, you know, these are the kind of, I want to hear about how these things actually affect you. And then I'm going to adjust these techniques. We're going to adjust them based on your feedback. So it's why like an Ayurvedic doctor, right, treats acute symptoms when we don't, right? So like, here, take this, you know, you have a super high fever. Like we don't have any of those skills, you know, so we're sort of existing in a different way. What's more powerful about yoga therapy is that the sort of getting you out of a chronic problem and then keeping you out of it is sort of our superpower, right? Like here's your self-care based on feedback from you individually on how to stay healthy. But I see why you're asking all these questions, because it's all very messy.
Yeah.
They cross all over the place.
But
we only do yoga. Yeah, but we only do yoga techniques. That's what I'm trying to say. Like, that's what we do. Like, we're all about how do you administer, how do you teach somebody to practice in a way that makes them better. That's all we do. Right? We don't, I mean, we might say go to bed earlier, you know, but like, that's not our thing. We're not all about lifestyle and food and medicine, right? We are mostly about which asana, pranayama, meditation techniques are going to get you where you want to go.